taking advantage of the COVID-19 pandemic with problem-based learning. I am Professor, Dr. and Engineer Roberto Alejandro Rojas Holder from the Faculty of Engineering at Universidad Nacional de Asunción. The COVID-19 pandemic, which caused so much havoc in the world as well as in Paraguay due to its danger and high mortality, forced the entire society from ministries of health, public works, universities, industries, entrepreneurs, deliveries, and other industries um, to help in that critical conditions. From the civic world materials one chair, we were also learning from the moment through problem-based learning, which was launched during said pandemic, where classes were virtualized and where all teachers, managers, and students, as well as parents, worked to find the best for everyone and took care of each other with the use of mass quarantines. Um, and we did it with virtual classes. This project was the result was for contingency hospitals who were and places of vaccination who were made in this time. Paraguay, upon the arrival of this coronavirus, had to undergo a state of quarantine to avoid massive infection caused by it. Although it is known that the hospital system in Paraguay is not in optimal condition to face massive infections, which will cause collapse in hospital care services for the community affected by the disease, Paraguay devised a health emergency plan which consisted in the construction of two contingency hospitals made of prefabricated materials which could be complete in the shortest possible time, in our case in 30 days, exclusive to provide medical monitoring and treatment to people who suffer symptoms of the coronavirus. Virtual classes were held, organized by the Teaching Innovation Department of Faculty of Engineering, where a module on problem-based learning was developed using active methodologies. In our case, we used the problem of contingency hospitals and other meeting places that are appropriate for the health of the affected population that could be affected, so that the problem arose of analyzing the provisional structures that were initiated, what materials to use to have the best environments, less transmitters of the virus in order to contribute and learn at the same time. The instructions were as follows, uploaded to the classroom platform. Many times it is necessary to plan a work with non-traditional materials that are easy to place in a timely manner. So read the learning part based on problem solving for the case of contingency hospital due to the COVID pandemic. Investigate what materials were used and indicate the ease of placement they present and the mechanical, physical, and chemical properties that they may have in each case in their structure, foundations, pillars, walls, ceilings, opening, furniture, facilities, biosafety, mask, artificial oxygen tanks, and others. We did it in 6 and in even a 7th phase. Phase 1 was the situation described recently. The phase 2, the facts, search for informative and enlightening for material terms, high contagion, social distancing, isolation, quarantine, number of beds available, quantity of respiratory and intensive medicine equipment. Phase 3, the ideas, host by preparing some public spaces, expand and or build pavilions in hospitals, create temporary and hosted places, isolate areas and cities, build contingency hospitals, buy suitable equipment beds. Phase 4, known data, teacher and students. Traditional construction was a long time of construction. Extension or construction with non-traditional materials with temporary structures, alternative to the previous one. Take advantage of public buildings such as hospitals, schools, stadiums to house the infected and carry out treatments. Strengths of materials were also considered. Manufacturing safely equipment and respirators locally, import safety equipment and respirators. Phase 5, actions, teachers' guidance and students' interpretations. The traditional construction was discarded because of the urgency of the case, use of non-traditional materials because their ease of placement in addition to their ease of disassembly once the pandemic finished, the use of public space to build with alternative materials, infrastructure, steel structure, plastic materials for their ease of placement, what physical, chemical, and mechanical requirements must the materials meet, combination of solution was carried out, and biosafety requirements. All these were considered, these actions. And phase 6, the feedback, teacher to consolidate what they have learned about this situation, the not useful under the circumstances, the traditional materials, technology available from local companies. 3 and 4, what the concrete floor should be like, joints, reinforcement, installation. All these were developed by the pupils. Search for specification and standards regarding both material and construction. The 5 and 6, construction with local companies and materials and imported, beds imported and others built in the country, respirators, safety requirements, manufacturer models. The equipment must comply with the regulatory biosafety specifications. Phases. Well, we talk about the 6 phases. The 7th is take care of yourself by the COVID way of living. Consideration for hospital planning, design, and construction teams. When a health center is built, plans are made for future remodeling or expansion as the situation warrants. The team is in charge is responsible for ensuring the said project is carried out as orderly as possible, thus working together, having optimal performance that is reflected in the work. Some of the important considerations as follows: having a clear and accurate understanding of the hospital vision and how the department service apply to that vision. Maintain a good organizational approach to examine whether new models of care delivery and project delivery require a different organizational approach for the team. Ensure you have a good handle on the basic service that the team must provide to meet the hospital's capital project load. Prefabrication, alternative method. Prefabrication in general has been a topic of debate. For some, it is synonymous with disposable infrastructure. For others, it means better use of time, materials, and cost reduction. However, it also represents the most important solution for hospital. Prefabricated system for hospital and equipment. A modular system in glass and stainless steel for the construction of surgery rooms, intensive care units, and laboratories. The building system meets all medical and structural requirements. And also the system integrates walls, ceilings, installations, air conditioner, laminar flow, electric components, medical gases, automatic doors, windows, the installation of medical equipment, operating room, articulated arms, surgery lamp, control panels, etc. And material properties, for example, they were considered an alloy of aluminum, a BW 6080 T6, warranty 20 years, standard wind here 140 kilometers per hour, fire standard, REI 30, snow standard here is not applicable, enclosure material, and the cost. So they talk about the materiality, walls, ceiling, floors, sanitary installation, electric installation, lighting, the hot, cold air conditioner. Here we have a very hot climate, security, fire detection, extinguish system, fire extinguishers, alarms, signage. In the world, we have the example by the internet research, modular emergency hospitals, hospital ships, mobile hospitals, and medical emergency modules. For example, these modules in China and other countries. In Paraguay, we have a local INERAM at Itagua, one of the hospitals, and others who were built with wood, metal structures, yes, and also panels, thermoacoustic panels, metal, and also plastic materials. The foundations was also they talk about the soil, of foundation and about the materials and the concrete floor. The result of the evaluation during the pandemics for civil work materials, it was carried out. All this work was one of 7 of the points. Of 7 points, one only was dedicated to works. So that was a real problem in our regulatory system at the faculty. This year we have a new plan, 2024. So we, in our chair, we use 17% for the evaluation of the process for the works like this. So we have in this period in brown and in blue in the center in the three set of columns approved 100%, nearly 100%, a very high qualification of 5, and a few 3 or 4. Conclusion: the high level of learning during the pandemic and from the homeworks presented were practically unparalleled. The detail of equipment, even of those of us that don't construct or design hospitals, give us an insight of the problem. The type of material, structural and functional, were identified. More hours to work it out because the study hours at home were increased. Activities outside the home were at one time prohibited and another time regulated. So they were able to dedicate themselves more, taking advantage of the topic of the moment, such as vaccination sites and contingency hospital, as well as all the health measures of that moment that all humanity suffered. Simply by searching the internet, a lot of topics came up. Therefore, their problem-based learning was very effective considering the level of students in the third semester of civil engineering. It reinforces academic theoretical knowledge, autonomy, and the development of research and self-teaching skill of the students. It is recommended to carry out surveys or other forms of evaluations by the participants to have the degree of their impact and thus be able to improve the process. This was later seen in subsequent investigations with other active methodologies. Thank you very much for your attention.